I'm Executive Director Kevin Robertson, and this is a KDA Video Minute for Friday, March 7th.
The Kansas Dental Association is once again hosting the Real World Transition Brunch during the UMKC Midwest Dental Conference. If you are a dentist looking for an associate or wanting to sell your practice, this is a great opportunity to connect with dental students entering the profession. Visit ksdental.org to register or for more information.
It's been a couple weeks since we've had a Video Minute because last week, of course, we were in Dodge City at our Kansas Mission of Mercy. Hopefully, you were able to see some local coverage of the events, as well as checking out our own social media and posts that we were making via Facebook, Twitter, and our other accounts that we use on KDCF and KDA. Just a quick update, we did see about 1,100 patients, a little over 1,100 patients. Our numbers were down a little bit this year because of the weather. We did cut some of the clinic activities short on Saturday, which lowered our numbers a little bit, but still, we were able to do over $800,000 in patient care. We certainly appreciate all the dentists that were able to make it out to Dodge City, that traveled from Kansas City, Wichita, Southeast Kansas, Independence, wherever they may have come from to be part of the Kansas Mission of Mercy. Of course, a special thanks and shout out just really to Dodge City, to the facility there at the Great Western Bake Expo that we use, as well as Dr. Rick McFadden and Dr. Richard Stein, who were the local arrangements chair people there in Dodge City that just did a fantastic job, and their whole committee putting on a fantastic event. And we hope that in 5 or 6 years, or whatever the timetable may be, that we'll end up back in Dodge City. We look forward to doing that. When we last reported on legislation, remember there were a couple bills that we had of interest. The fluoride bill, House Bill 2611, of course the mid-level bill, some different things that were going on, and they were getting ready to vote. Well, the fluoride bill was tabled in committee, which basically killed it for this legislative session. Now, we did hear reports that some of the proponents of the anti-fluoride bill were trying to get another bill introduced in the Senate. That has not occurred at this point in time, and we'll continue to monitor that and, of course, very closely to see if that were to happen. Then House Bill 2611 was the bill that changes the 50% rule with regard to satellite practices, and being in a satellite a majority of time, changes that to 20%. That passed out of the committee last week, and then it was also then voted on and passed the full House 123-0, and which moved it on to the Senate. The Senate has appointed House Bill 2611 to the Senate Committee on Public Health and Welfare, who has scheduled a hearing next Wednesday on March 12th at 1:30. So I'll be testifying, as well as Dr. Brett Roos and others, supporting that bill as we hope that that bill will help provide further access and allowing private practice dentists more opportunities with regard to satellite practices. There is no new information really report as far as the mid-level issue at this time, and we continue to monitor all different legislative activities, whether it's Medicaid, expansion, CanCare, whatever it might be, insurance issues as we move forward this legislative session. We now turn our attention to the UMKC Midwest Dental Conference, which will be April 10th through the 12th at the Sheridan Crown Center in Kansas City. That's the old Hyatt Regency that now has changed its name, that has traditionally hosted the Midwest Dental Conference. Like always, the KDA has several council committee meetings, board of delegates meetings, and again, for the second year, we'll also have our annual business meeting during the time of the conference on Saturday. So several councils and committees have been set, including the Kansas Dental Charitable Foundation Board, the KMOM Advisory Committee, membership committee is going to meet, legislation, dental workforce, and again, a variety of meetings. We're right now firming up the times of those particular meetings. They'll be held really Thursday, Friday, or Saturday. So if you're on any of those committees, please be paying attention to meeting notices that might come out, and please try to attend those, particularly if you're planning to be at the UMKC Midwest Dental Conference anyway. Board meeting will be on Friday, April 11th. We'll have our General Assembly will be on Saturday, April 12th. And then as kind of a change this year, as opposed to having our traditional President's Dinner on Friday evening, we're going to host a a president's reception from 5:30 to 7. We'll honor our Dentist of the Year recipients at that time, and our active life members and our Harry M. Clendia award winner. We'll actually present the awards during our annual business meeting on Saturday, but we still want everyone to come and certainly congratulate them for the work that these people have done with regard to dentistry. We have not yet announced the award recipients, so we'll be doing that soon. Well, as we finish up today, certainly want to do a shout out to Wichita State and a great 31-0 season. And for KU and K-State for having great seasons too. For the second year in a row, 2 of our 3 1A basketball programs have won conference championships. I think that's something we can all be proud of, and we'll get a chance to reminisce, I'm sure, after the tournament when we get together April 10th and 12th at UMKC. Also, as we wrap up, we're going to leave you with a little footage from KMOM. Got a little to kind of give you the feel of the experience of KMOM. If you were there, I know you had a great time. If you've never been to a KMOM, we've done 13 now. But if we've never been to a KMOM, still want you to think about the opportunity. Next year we'll be in Salina in mid-February, and really put that on your schedule and try to be in Salina in 2015. We look forward to the opportunity to continue to serve those patients who otherwise would not receive dental care. Thank you very much, and we'll have another video minute next week.